We are live. I just couldn't see it yet, but okay. Now, Amy, before we can start, if you can just maybe stop sharing for 10 seconds so we can introduce ourselves. Amy? Oh, we left Amy while we were, so she'll come back. So I know we are live right now, so I'd like to start. This is United Medical ACO diabetes program, and my name is Kamal Erkin. I already had a live session this morning or this afternoon, so this is the second time today we are live. So we are having a very small technical difficulty. We actually lost our leader, Amy. She's coming back. All right, here she is. Hi, Amy. So, I just did the intro, and you are on mute. That's fine. So we are going to go ahead and start the presentation. We have a guest panelist, and we have some items that we are going to go through with the fitness program, and I will ask our members to just introduce themselves. Donna, we can start with you.
Sure. Good evening, everyone. I'm Donna Gunkel. I'm the Director of Clinical Integration, and I oversee our diabetes and nutrition program. Go ahead, Amy.
Well, I'm Amy Wilcoxon. I'm a dietitian and diabetes educator, and I work in our nutrition program and diabetes program, doing individual counseling and group counseling before the pandemic, and now with our webinars.
All right, and I'm Tim Mchugh. I'm a physical therapist with SOS Physical Therapy. We're part of the United Medical ACO, and I help out with Amy with the diabetes class when we were doing it in person, and when we talk about physical activity and exercise.
All right, so everyone introduce themselves. So then, Amy, we can start with the formal part of the presentation.
Okay, could you share your screen, because I had to switch computers?
Of course. Or Tim, are you?
Or Donna or Tim.
Tim, are you able to share your screen, or?
I do not have it here to be able to share it, I don't believe.
Should under the
I do not have the, sorry, I'm on a tablet, not on a desktop, so I don't know if I could pull up the PowerPoint to be able to share it. Yep.
All right, so what I'll do is I will share my screen, and then I will click up to the point that Tim is presenting, so then I'll have him try to click from his side. We'll try that. Otherwise, I can do it from my side, no problem. Got it. So, all right. Now, before we actually go further, we do want to make sure that we mention Dr. Ruku Hamdallah. He's our program director and endocrinologist with First Aid Endo. And then we have Jackie Masari, she's a social worker. And then you guys already know everyone else on the call. And Amy?
And we have, this is part of our Wellness Wednesday webinar program. So this is our second one of the year. We started last year in 2020, talking about all the different things that diabetes affects, all the different parts of your body, your brain, your life. So we're continuing on with the series. And today we're happy to have Tim speak about exercise and activity, particularly trackers, which I know a lot of people like to use, and I will be talking about home exercise. So we'll start with Tim.
All right, so Tim, I did just give you access. Let's try it if it works.
Okay.
Yep, it does work.
Yep, seems like it's working. All right. It's good. So yeah, so we're going to talk about fitness trackers. And there's a couple things we want to talk about. One, just things to consider when you're thinking about getting a fitness tracker, and then different ways you might utilize them to to help measure or track progress with regards to exercise and activity. So obviously fitness trackers aren't necessarily new. They've been around in some version for a long time. And so whether it's a simple tracker like a pedometer or, the technology that we see today, all of that counts as it's tracking exercise and activity. A couple of numbers here just shows over the last half decade, 5 years plus, just the increase in the number of people who are wearing fitness trackers and wearable devices worldwide. That number might be a little bit low compared to where we are today, but you can see how that's growing and how many people are using these. Now, let me see if it'll advance. I don't know if it's not advancing for me. Let me see if I can get it here. There we go. All right. So a couple of things to consider when you're thinking about fitness trackers. One being what are you going to use it for, right? And so it's not just tracking steps. You need to know what else you're going to use it for. And so depending on what you're going to use it for, you're going to want specific features. And so whether you're a swimmer, whether you're a runner, whether you're a cyclist, whether you just want to track your general activity throughout the day, there's going to be different features that you're going to want to consider depending on what that is. So not necessarily all fitness trackers are going to be waterproof, and not all waterproof fitness trackers are going to be able to track what you want to track with swimming, for instance. If you're a runner, you're going to want to be able to see certain things on the display with regards to your pace or your distance or your time. Cycling has its own information or data that you're going to want to track. And so you're going to want something specific for that as well. So depending on what you're going to use it for, how you're going to use it, you want to look into those features before making that decision. The app is a big part of this as well. And so that's where all your information is going to be collected. And so you want to make sure you investigate that and spend some time looking at that as well. Because if it's not clear, if it's not easy to find that information or to track the statistics that you want to track, you're not going to utilize it in the way that that's going to be helpful in terms of really impacting your exercise or your overall fitness. The other thing that you can always try too is before investing in a fitness tracker, there are apps that you can use to track your fitness, right? And so it might just be downloading an app on your phone and testing it that way. It might require you to have your phone on you while you're exercising or while you're walking or while you're doing whatever activity you're doing. But some fitness trackers require that anyway to collect the information that they need. So downloading an app and utilizing that first, again, might be an easy, more economical way to get started versus spending the money on the tracker itself. Now, in terms of, I think we missed a couple slides there, but in terms of, oops, I don't know how to go back on here, but in terms of fitness trackers, the thing that we really want to know is how does it impact our exercise decisions, right? And so thinking about why people stop exercising or why people don't follow through with programs. One is, I'm too busy, I don't have time. Another might be lack of motivation, or another might be just that they're not seeing the results that they want, right? And so fitness trackers are helpful, especially in tracking those results and following that information over time to see that you're meeting your goals and making progress the way that you want. Now, one way that you can do that, and we'll talk about it in a minute, is using your heart rate, right? And so if you have a fitness tracker that is also measures heart rate, you can utilize that to set goals and to track your progress over time. And so, here's a list of information that most trackers are going to keep for you. And so it's going to track your heart rate, it's going to track your activity or inactivity, your sleep, your calories, all that sort of stuff. And so you can use those to set goals, and then you can go back to that dashboard and follow the progress over time to help set goals so that you can stay consistent with your exercise or fitness routine, whatever it might be. All right, so let's go ahead there. All right, so one way to set goals with using your heart rate, right? So if you have a fitness tracker that is also a heart rate monitor, which not all fitness trackers are, again, depending on what features you want, it's going to affect the cost, obviously. And then even if you have one that doesn't measure heart rate, you can buy or you can get a heart rate monitor strap that you can pair to the device. But one way you can track goals using your fitness tracker with heart rate is you can measure your resting heart rate. You can measure your recovery heart rate, or you can measure your average heart rate, and you can track these over time in different ways to meet those goals and see that progress. And so that's what we're going to talk about here for a minute. Why measure heart rate? Again, it's an easy, objective measure to give feedback. It's efficient and precise. And then again, follow-up wise, it's easy to come back to and remeasure over time to make sure that you're seeing that progress. Now, your maximum heart rate, it would be your starting point. You need to know what that is to kind of work off of with some of these things. And so your maximum heart rate is generally 220 minus your age. And so this number is consistent. It's not affected by your fitness level. And so that's kind of your baseline starting point. So if I'm 50 years old, my maximum heart rate is going to be generally 170. If I'm 20 years old, it's generally going to be 200 as the maximum amount of effort, or my heart rate when I'm giving maximum amount of effort. Now, that's important because when we start looking at some of these other ways to track heart rate, we're going to need to have that to base off of. Your resting heart rate is going to be it is affected by your fitness level and by exercise, right? And so that's why this is a good measure to use as you're making goals or as you're tracking progress. So normally your resting heart rate should be between 60 and 80 beats per minute for an adult. And so you can get this baseline to start with. And to do that, you can take it in the morning when you first get up before you've been active. Take it for a few days in a row to kind of get an average of what it is over those couple of days. And then use that as your baseline to see how it changes with exercise. And so, you can track, oops, not too far there. You can track your exercise over time. There's other things you can do that affect your heart rate, whether it's be your overall health, your sleep patterns, right? So again, if your fitness monitor, your fitness tracker is tracking your sleep, that can impact your overall heart rate. Smoking is going to impact that heart rate. And so measuring that baseline of what your resting heart rate is and going back and measuring it as you get into your exercise program is an easy goal to set, an easy way to use your fitness tracker to see how that changes over time. The other thing would be your using your heart rate during your training to determine, are you exercising at an appropriate level, right? So here's a chart that's showing what percentage of your heart rate max should you be at when you're doing different activities. So strength training, for instance, puts us in this green moderate level. It should be generally 70 to 80% of your maximum heart rate. And so if this is our dashboard, or if this is our information that's collected by our fitness tracker showing my heart rate over time during an exercise session, you can see if I'm exercising here for an hour doing strength training, I'm hanging out in that blue range for a majority of this time, right? So that's telling me I'm not getting to that 70 to 80% of my max heart rate where I should be when I'm strength training, right? So it's giving you that feedback to know that I can do more or push harder with this activity to be in the right training zone during that activity. So that's another way to use your fitness tracker or your heart rate monitor to determine where you are. Another way is your recovery heart rate. So this is the rate at which your heart rate returns to normal after exercise. You can measure this a couple ways. You can measure it over a period of time, or you could measure it in terms of how long it takes to get to a certain heart rate. And so in general, you'll see on this next slide that the steeper that drop is, or the deeper that drop is, the better, right? It's an overall level, or gives a general idea of what your fitness level is. And so If I'm doing interval training and I'm doing interval runs, for instance, here again, if I'm looking at my statistics from my run, the chart's showing me that I'm getting up into that red zone and then I'm dropping down during that interval. And the steeper that drop is, or the lower that goes, the better, or my better overall fitness I would have. Or here at the end of that run, you can see how long it takes to drop back down to that blue zone, right? So again, the quicker that drops or the steeper that drops, the better my recovery, the better my fitness. And so again, an easy thing to compare over time and see how that changes. Average heart rate is another easy measure to take and measure over time. So with this, you would get on the treadmill, you would walk or run for a specific duration. In this example, I have 15 minutes for 5 miles per hour. And you would do that and get what your average heart rate is. So here I have 155 beats per minute. You're going to go through your exercise program for 6 weeks, and then you're going to come back and retest it with the same duration, same speed, same incline on the treadmill, and see where your average heart rate is at that point, right? So again, the idea being that the more we train, the better that is, the lower that heart rate should be. And so that's another way to track and measure your progress. So even if you don't feel like you're doing more, you might be. It might be that you're more physically fit and able to do more at a lower heart rate. Heart rate trackers also track more than that, obviously. So they're also tracking your overall energy expenditure. They're doing that by taking that inactivity time plus the active time plus your exercise or the amount that you're exercising to give you a number for that. Why do we measure that? Because that's going to influence your goals, whether it be weight loss or weight gain. It helps give you information in terms of making plans or adapting or modifying your fitness or exercise plans. It tells you if you're consuming enough or not consuming enough calories. And then you can make changes based on that. Generally, it's going to calculate your movements, and your movements are converted to METs, which are metabolic equivalents of tasks. And then that's associated with a specific activity. So you'll see on this next page, or this next slide rather, different activities have different metabolic equivalents. And so, the more strenuous the activity, obviously, the greater the number. But your fitness tracker is going to have that all built in and use that along with your personal information to determine some of those calories in terms of energy expenditure based on what you've been doing or how active you've been during the day. Same thing, sleep. Sleep can impact your ability to make gains with exercise, and then it also affects your ability to recover with exercise. And so having that information is helpful to know, again, if you need to modify or change fitness plans based on what that is. So technology is half of it. It's nice to have and track on a daily basis, but really to utilize it in a way that's going to impact your overall fitness and activity level, you really need to track it over time and set goals based on that, and go back and compare kind of where you were 4 weeks ago or 6 weeks ago with where you are now, and use that information to help set new goals to continue to progress in terms of exercise and activity. So, I think that next slide is Amy's portion.
Okay. Any questions or comments for Tim?
I just wanted to comment. So I wear probably a very basic one. I wear the Fitbit. I did upgrade to the Fitbit 4 recently simply because I guess the light in the Fitbit was going, and so I could only see portions of my information. It was kind of like going in, so I could only see part of it. This one actually has some additional features that the other one didn't have. Number one, it has large numbers, which make it easier to see. I don't know if you guys can see that. It has large numbers. It also allows you the ability to, keep up on, change the face. So maybe, for some people that could be important. What do I want to see? Do I want to see how many steps I've taken? Do I want to see my heart rate on that main screen? So you can change it for whatever may be important in your life. And I know you didn't really mention some of them, but I do think it's important to think about, like what you said early on, Tim, what it is that you want to see. Because sometimes I think we can be overwhelmed by technology. And so, deciding what it is that you need to see or what you want to track. So I don't know if you want to talk a little bit about maybe.
No, I agree. I think, I agree. I think, again, depending on what you're looking for, you do want to look into that and see what's going to be the most beneficial for you. So, right. So I don't have an activity tracker that I use in general, but I have a GPS watch that I'll use when I'm running. Right. And so when I was looking, I knew I wanted one that would show my average, that would show my pace and would show my distance and show my overall time all on the same screen where I could clearly see them. Right. I didn't want to have to be flipping through the screens or the face to be able to see that. So you're right. So depending on what you're using it for, you do want to kind of search that out or look into that to see what information can I display, what information can I display at once, or how much am I going to have to scroll through this to find what I want to see, and how easy is it to get there. Yep.
No,
and I'd say overall, looking into the different fitness trackers, the Apple Watch overall generally gets the highest ratings across the board in all the categories, right? If it's a specific activity or specific use, then, there might be one better for running, or there might be one better for something else. But the overall general use, they'd still get the highest rating.
So I have a
Sorry, go ahead.
question. So when we actually, from this program standpoint, when we look at our patients who are the average patient with diabetes,
right?
So, Tim probably doesn't have diabetes, and he's probably in perfect shape, and Don is not maybe the best example, and we may not be the best example. So when I know the phones have these applications already built in, and if I keep my phone all the time with me, and if I'm an average patient with diabetes, like I'm talking about patients maybe a little bit on the obesity side, like
right,
I-32, like instead of just being like a professional tennis player versus just to live my life without being controlled. Would the phone do the same thing in many cases?
It will in a lot of ways, right? And I think, again, that's oftentimes a good starting place, because you can, most phones, like you said, come with something that will track some of that basic information for you, or you can download an app. Even if you have to pay for the app, it's going to be significantly cheaper than buying a fitness tracker. So, I think Fitbit does have an app that you can download and use without having a wearable device on. And so there is ways to do that using your phone that'll collect a lot of that basic information to give you a starting point. And then, like I said, once you are more familiar with it and maybe know what it is you want to track and have a better idea of how you want to use it, then maybe you go out and get something to wear, or something more expensive that maybe does collect a little bit more information, or use it in a different way. But yes, I think you can definitely find things on the phone that would work well.
And I still recommend little, in fact, I just did this week, the little old pedometer that you can get for $10 at Walgreens or Walmart. You clip it on your pants. It doesn't require any app, smartphone, anything. Right. It measures your steps. And we'll say, if you're walking, see if you walk 2,000 steps today, see if you can do 2,200 tomorrow.
Right.
Just try and do more.
Or when we talk about it, like when we were in classes, I would always say, track it over the week and set your weekly goal, right? Because sometimes your days are going to vary so much day to day. Like you said, you might walk 2,000 steps a day and 7 tomorrow. If you generally walked, 30,000 steps this week, next week try and walk 32,000, right?
So in some cases, it just gets a little bit overwhelming. for patients that they already have a lot of, restrictions. They have to count what they eat. They have to do the blood pressure, the blood test, and it's just like if there are certain things already built in, just to kind of make it base, as you said, so it would be a lot simpler, because a lot of people, like a lot of my friends, they don't know that they have this already. So I actually turn it on, and then they get their like historical data, because it's still that. So like, Amy is giving me the book, and she doesn't know that this is happening on her iPhone, but it is happening. So,
I have my own apps.
so, yeah, like this is like even if you don't use it, this is still available.
In the health app, right?
Yeah,
I know.
yeah.
I just don't use it. It's not my garment.
With the iPhone, actually, they can tie this into their patient portal, Donna, so that the information is already synchronized. So that's actually a good way to get the information to. So I would definitely tell them about the phone. I mean, I know the iPhone, I don't know the other ones, but I'm sure they have something similar.
Yep.
Well, and there's free pedometer apps that you can put on any phone.
Yeah.
You just have to carry your phone. And for some women, I mean, men often stick in their pockets, but women, I mean, Donna, you might say this. When I'm home, my phone is not on my person.
Right.
So it's not
Yeah,
tracking.
that's why I like the Fitbit, because I figure it, I wear a watch all the time. So it's something that I don't have to think about. And then to your point, Tim, tracking it, I can just, whenever I'm sitting there, I can just, sync it to my app. And then I can look at my progress. I can look at how many steps I did that day, that week, that month. It tracks your sleep. It does a lot of those things, simply by just wearing it pretty much all the time, except when I'm showering or, swimming.
Well, and I think Kamal makes a good point that some people don't, it's too overwhelming to track now. So some people who don't want to count anything,
Right.
it's not the best thing for them. But other people, I had somebody I spoke with earlier this week who talked about they're in these Fitbit groups and these challenges. So they're motivated to walk more because they're in, and they don't know these strangers. It's whatever their Fitbit name is, and they want to beat them. So they want to be number one with so many thousands of steps. So if somebody who's interested in technology and data, I think it can be really appealing and motivating. But other people, it's one more thing to have to track.
Right.
Not so fun.
So with the I was just pulling my patient portal. So it says connect Apple Health to United Medical Physicians and allow Apple Health to access allergies, conditions, immunizations, medications, diagnoses, demographics, and procedures. So with our IT Health, so we may need to actually do a little bit more. So right now I'm going to allow access. So I think this would be a good way to kind of maybe also promote the patient portal, because many of the data retrieving from the patient is kind of the trouble for the offices. So this would be a good way to do that.
Yeah, that's great.
Now, I can't help but ask Tim, how is it that no kids, that we didn't hear any?
They're not home right now.
They're not home right now.
Yes.
Okay. So I'm like, how is he doing? I can deal with one dog. No noise. That's good. All right. Now, Amy, I'm going to go back to sharing the screen. So, and if I give you access on the mouse, let's try that.
All right, I'll try. I'm on a different computer, but I'm going to try.
So if it doesn't work, then no problem.
I need to go back. Let's see if I
Actually, Donna, can I give you the access, because it doesn't show me Amy has the access?
Okay. I can't.
No, Donna is
back, and I can't.
Donna is doing it, right?
Okay, let me see. There we go.
Okay, can you go back one? Oh, that's perfect. Thank you. I'm sorry. Okay. All right. So one of the things I've been talking about since last March is that nobody wants to go. Well, last March, the gyms were closed and now they're open, but people don't want to go. And I don't want my patients, I don't want people to go either. And I'm sorry for gym owners. But the gym can be a risky place, and I understand that, but we still have to exercise. So one of the things we've been talking about since we started the webinar series is that activity is really important for diabetes. Yes, it's one more thing you have to do. Yes, it's one more thing you have to track. I'm sorry, but it makes your body's insulin much more sensitive. When you move, after you eat, your muscles need the glucose in food. So if I eat dinner, let's say I have a sandwich for dinner and I'm moving around that sandwich, the glucose from the sandwich, some of it's going to be pulled by my muscles to be used for activity. So it is really important. And we use the word activity because some of the things that Tim was talking about, like running, cycling, swimming, that could be overwhelming. Maybe that's too much for you to do. And so activity, moving around, counting, walking in your house, counting steps, all of that counts. It's really cold. It's supposed to be 15 degrees this weekend. So you might not want to go outside and go for a walk. I don't know if I want to go outside and go for a walk. Secondhand equipment. This is a good time of year. A lot of people are getting fancy new Pelotons, so they're getting rid of their cheaper equipment. Facebook Marketplace, Craigslist. There's the neighborhood pages next door. A lot of times people are getting rid of stuff. And then there's also stuff you can do at home with no equipment that's free. So there's always something you can do. Even if you have a very tiny space, there's always something available that you can do. Okay. So look, if you want a DVD, if you don't have a computer that it's easy to move, so if your computer doesn't hook up to your TV and you don't want to have to stare at the small screen, that can be hard. You might want to get DVDs, and you can get them at the dollar store for $1. They're pretty cheap. Things like Jillian Michaels, she's at the well, not Jillian Michaels herself, but her DVDs at the dollar store. And then there's things that are more walking in place, slower, and lower. Jump rope and hula hooping are both back. You can get weighted ones, you can get normal ones, you can get cheap ones at Five Below. There are things on YouTube showing you different exercises with them. There are a lot of subscription programs. Some gyms that were only in person are now available, like Pure Barre, for an example, which was a chain. It is a chain. Now they have a subscription program that's paid, and then YouTube. So if you have a smart TV, if you have the Roku or the Fire Stick, it's easiest to do YouTube. Or if you just have a really big computer monitor, that can be the easiest way. So some popular paid ones, Walk at Home. Leslie Sansone is probably the one I recommend the most to anybody. She's also free on YouTube. We're going to talk more about YouTube in a bit. Les Mills On Demand, which offers strength, yoga, cardio, stretch, high intensity interval training, and dance. So that's another very popular paid one. Beachbody On Demand is another very popular paid one. Those run somewhere between $100 to $130 per year. Or you can pay, I believe, on a monthly thing, on a monthly level. So they do offer, both of these programs offer very basic, more lower level programs, and shorter ones to very advanced, and they tell you what they are, but they're not free. And then Leslie Sansone, the Walk at Home, which I'll talk more about. Peloton, I think I see a commercial all the time for Peloton. It's a cycling. It's something that a lot of people were hearing about at home. They do have it now for running, yoga, and bar, and they have a free 2-month or 3-month trial before you have to pay Jazzercise. There is some free on YouTube, but it does have a paid subscription also, Pure Barre and Bar 3. And then if you have a subscription to Amazon Prime, they actually have a lot of exercise videos. So you can just look for exercise. If you like to dance, look up dance. If you like Zumba, look up Zumba. Yoga, bar. They have a lot of different things you can do. So it's worth really taking the time if you think, tomorrow I really have to start exercising. Take the time tonight to sit down and see, all right, what's on YouTube? Let me see, or what's on Amazon Prime? I have Prime, I'm paying for it, I might as well use it. Let me look through and see. And maybe I'll start with like a short 7-minute one, just so it doesn't seem so overwhelming. So YouTube is my favorite place to start, and that's what I usually recommend. There's a lot of different things to think about. The one that I recommend the most is the one I talked about or the most often, is the one I talked about earlier. Her name is Leslie Sandstone, Walk at Home or Walk Away the Pounds. And she's been around for a long time. She's got DVDs. Some of you may know who she is. And it's walking in place, so you do not need a lot of space. Some of her newer ones also utilize the resistance bands when you're walking, so you're getting in some strength also. But it's something that you can walk a mile up to 3 miles. So if you feel like, well, I can't walk 3 miles, that's a long way to go, or I don't want to walk 3 miles in my house, that's a lot to do, you can stop after a mile, and that mile is enough to help lower your blood sugar. So even getting up and doing something for 2, 3, 4, 5 minutes is better than sitting on the couch. Yoga with Adriene is another one that I frequently recommend. And for the reason that I just talked about, is that she has workouts that are 5 or 6 minutes. And then she has ones that go to an hour. If you have a stiff neck because you're on the computer all day, she has one for that. If your stomach bothers you and you need some moves to help with digestion, she's got one for that. So she's got all different kinds of things. Pop Sugar Fitness is a company and an app, and they're on YouTube, and they have a website, and they have everything. So if you want to work your upper body and make it stronger, if you want to work your lower body. So in this past year, I've done a lot of research to find some other things that our people can do. And that one seemed to have a really big variety of things. That one and Fitness Blender, which Tim actually told me about several years ago. And I really like too, because they have so many choices. So you can put in, I want no equipment. I want a beginner workout. I want it to be 20 minutes, and it will filter out and show you what they have. So that is, and Tim, are they physical therapists who do it?
I don't think they are. No.
Okay. So, but they seem to be good workouts, right?
And then they also do, I believe, I haven't looked on there recently, but they also do have the option where you can mix and match the program you want to use, or you can pay for a program and it'll tell you to do this, this video this day, and this video the next day, and this video the next day. So you can do it either way there. They have the free option, or you can pay for a specific program.
Oh, that's good to know. Okay. And then Blogilates is a woman whose name is Cassie Hub. She's got a calendar, which hers is all free also. It's a calendar you can sign up for. She'll send to you, and they're short. What I like about them is they're short workouts you can do in your pajamas. It's mostly Pilates. That's where the Blogilates come from, Pilates and core. Fitness Marshall and Kukawa Fitness and Jessica Smith are all dance. So they have a variety of levels, their variety of moves. When I asked for recommendations, I got a lot of recommendations for Fitness Marshall that people thought he was really fun and funny, and they liked to move around and dance around with him, and it was pretty entertaining. I tried it, although I'm not good at dancing. I've got 2 left feet, so it was pretty entertaining. So there's a lot you can do. When you're at home, you really want to know your limits. So if you haven't exercised in a long time, you want to be careful. There is a disclaimer at the beginning that you should talk to your doctor, and that is true. So if you decide to do some high intensity interval program and you haven't exercised in a long time, that might not be the safest thing to do. So activity is really important, but walking in your house counts. Consider safety. Is your floor slippery? Is there no support for jumping? Should you not really be jumping yet anyway? Start small. So if you haven't exercised in a while, start with a couple minutes. So if you think, well, I used to walk 3 miles 3 days a week, but that was a whole year ago. Well, maybe start, can you walk 5 or 10 minutes? Can you walk a half a mile? If you're not really sold on different programs and you think, well, I don't want to go on YouTube, or I don't have a computer and my internet is spotty, or I can't see my computer, all movement counts. So some of this goes back in with Tim with the tracker. If you mop the floor, that counts. That's movement. If you walk up and down the stairs, that counts. Scrubbing the tub, cleaning the oven is a lot of scrubbing. It's hard work. So all of that really counts, and you can spread that out. So if you think, well, I'm going to clean the kitchen floor, I'm going to wipe down the walls the next day, and spread that out, that gets in some movement. So it's really for your blood sugar about getting up and doing something most days of the week. If you have to pick a time and you think doing something after you eat is especially beneficial, In some cultures, they will do a stroll, a walk for digestion after they eat around the block, not really for exercise. And studies have shown that those walks will help lower postprandial blood sugars after meals. So definitely getting up and moving after you eat rather than laying on the couch is really helpful too. And I think that was my last slide. Okay. Any other questions, comments?
Right. So the just I think these sessions do help from the person's from our personal lives. It's a lot easier to sometimes make that decision and not to just get up and walk. The easiest way and safest way right now is go out and then just couple blocks walk and come back home. Now, better actually, you can go to Brandline SPCA and adopt a puppy. So you are forced to walk. And I mean it, I'm not kidding. So it actually is good for the mental health, and it is good for the for you to be kind of you have to go out with the puppy, and then it would be the best time to get one if you have no reason to walk. So I think we just need to find that like no excuse zone, and then just start doing some of these things. And we are all guilty of them. Like, I'm not going to pretend like this time in the last 4 years I'm back to almost normal, but a lot of dieting and then trying to kind of push ourselves to do more stuff, keep ourselves active. It's difficult, but I think best would be, I didn't realize how important it was to work with one of the nutritionists or someone like Tim, maybe even the social worker in some cases, to overcome some of these problems. Because when we talk and then when we tell someone that we have these shortcomings and not making some decisions, not making commitments, I think it helps when you share with someone. It kind of puts that healthy pressure on you, so that you're able to start moving on, and hopefully everyone can do that.
Right. And I think another thing is, Amy, to your point, getting up and moving. So if we have the opportunity, and maybe we live in a 2-story home, and you're downstairs, it's not like, oh, I'll wait and do that later when I go upstairs. Maybe making that extra trip up and down the steps, even if it's to do something simple, to take something small upstairs or go get something and bring it downstairs. I think winter is probably one of the worst times, right? Because it's probably dark in the morning when we're getting ready and going to work. It's dark when we get home, so we don't really spend a lot of time outside. So looking for additional things that we can do inside to stay active, especially in the evening.
And that's a really good point about going up and down the stairs. That's something that we used to have back before Netflix and people were watching so many streaming things without commercials. We would always tell people every commercial, do you get up and go up and down the stairs, or depending on fitness level, do checks, do something, because we sit a lot, and so to try and do something small and then go back down and sit and then do something small is a good habit to get into.
Right. And I agree. When you don't have commercials, right, you tend to stay there longer and maybe get up only after you've watched something or after you've done something. So looking for different ways to get in a little bit more activity.
Now, if we don't have any other comments, I do want to just add one unrelated item. The COVID vaccine, there are some issues on the rollout. So it's different than what we were told before. We are getting new updates, and unfortunately it's not as like in a way that it's not coming quick enough. It was going to be, we were going to receive them this week for our patients, in case our patients would watch this today, January 27th. So we won't have the vaccine for at least another week, right? Maybe next week, but that's not even the case. And the other very common question that we are going to receive, and then again, we're going to take advantage of these videos. If you already received the first vaccine, the second one is not going to be in 3 weeks. It may be up to 6 weeks, and then there are no harm. Apparently, just because of the shortage, they're not trying to rush the second dose rather than just giving it to the people that know vaccine. So if in case our patients aren't following the vaccine updates, and I will be talking about that on our Friday session in that, so we can actually answer some questions if there are any. Friday is going to be at noon, our regular weekly event.
Right. I mean, we were just on a Department of Public Health call right before this meeting tonight, and it's not that we can't or don't want to share the information. The state is on many calls with, at the federal level with Moderna, with Pfizer on like a daily basis, and they're only getting information, Dr. Hong had mentioned, about 3 days prior to getting a shipment. So they're not even getting at the state level information about how many vaccines they'll get next week or the week after or the week after. They're getting it literally just a few days before each shipment arrives. So, it makes it hard for all of us to answer those questions, but they are getting them, and they're, all of the requests are in a queue, and then they're sending out the vaccines based on the request in the queue for, yes, the second doses as well as the first doses for those patients at high risk and over 65 in the 1B category now.
The good news, though, Donna, it seems that now there are more people who want to get the vaccine. And until this week, we were trying to make people more comfortable with the vaccine, and all of a sudden there's a shortage and everyone wants to get the vaccine. Amazing.
Yes, it does seem like it's really, which is a great thing. Hopefully that's just putting us one step closer to getting back to normal, hopefully in the upcoming months. It doesn't mean the second, as they mentioned, that doesn't mean as soon as you get your first or your second vaccine that you take the mask off and, everything's back to normal. We still have to follow the protocols, right, until we get the majority of the people, the herd vaccinated. So, but hopefully it's putting us a step closer.
All right. So, Amy, our next event, we are on the set for 2nd and the 4th Wednesday at 7 p.m. every month.
So our next one is February 10th. We'll have Dr. Peters from CREAS and Frantica Cohn, one of our other nutritionists, talking about. Do you want to say something, Donna?
No, I was going to say, I want you to talk about the topic.
Talking about diabetes after bariatric surgery. So I know people with diabetes considering surgery, often the question, is it going to go away? And what am I going to have to do with my diabetes? So they are both going to talk about that on February 10th.
Okay, sounds great.
Well, thank you so much for joining us tonight, Tim, Amy, Donna, myself. So thank you, and we'll see you guys next time. Bye-bye.
All right, thank you.
Thank you.
Good night.